From the News Channel 5 Network, this is Health and Today's Woman with your host, Dr. Kelly Williams. Sponsored by Murfreesboro Medical Clinic.
Welcome to Health and Today's Woman. I'm your host, Dr. Kelly Williams. As always, this show was designed to help women become champions of their own health care. Tonight we're going to discuss a topic that many of y'all have been exposed to and may not even realize it. We're going to talk about physical medicine and rehabilitation, something called physiatry in the medical field. I'm very lucky to be joined by Dr. Bill Newton, a physiatrist or physical medicine rehabilitation specialist at the Murfreesboro Medical Clinic in Murfreesboro, Tennessee. Now, I want to give you a little bit of information about Dr. Newton because I think he comes from an unusual background, one that I think deserves some recognition. And that is, Dr. Newton arrives to us from the U.S. Army, where he spent time in Georgia, at the Army base in Georgia, and also in Washington, D.C., at the Army base there. And I think that it's such a special thing because we really owe a great amount of respect to somebody who has served in the military, and something at the very beginning I want to address because I think it's something that we all need to say thank you to those people that are serving in our military, and especially physicians, because it is very difficult to find physicians in the military. Bill, I want to tell you thank you not only for your service to the military, which I think is incredibly important, but also for coming today. We really appreciate having you.
Thanks for having me, Kelly.
I want to start off by just talking about the fact that a lot of people have no idea what physical medicine rehabilitation is. Physiatry is a word they've never heard of. Kind of give me a little bit of basic understanding of what exactly y'all do.
Well, you know, physical medicine rehab is kind of the specialty that you never want to meet in some cases. Traditionally, we're seen as the physician that takes care of trauma, okay? Whether it be a brain injury or a spinal cord injury or just orthopedic trauma in general. We have a pretty broad education and experience. It's very heavy in musculoskeletal care. It's very heavy in neurology. It's even heavy from a neurosurgical standpoint. So there are multiple different disciplines within physical medicine that makes it a very important specialty.
Well, I want to take a couple of steps back here because one of the things that we always talk about is the fact that, you know, musculoskeletal, just you're talking about muscles and bones, and I think a lot of people don't understand that. Of course, neurosurgical is any type of neurologic problems such as nerves and things like that. Right. And we're going to come back to that a little bit. I want to take a little bit of a turn here because I think there's something else that's a little bit interesting about your background, and that is the fact that you're a DO physician. And a lot of people don't necessarily understand what that means, but there's two different types of doctors, and essentially they're the same thing. There's doctors of osteopathic medicine, and then we call allopathic doctors, or medical doctors, or MDs that we typically think of. And I want you to kind of explain to us a little bit what a doctor of osteopathic medicine does. You know, not having a school in the state of Tennessee, I think a lot of times people don't understand this. And give us a little bit of basic understanding what the difference is between an MD and a DO, because I know there's no difference. They're as well trained, there's no difference. But describe to me a little bit about your perspective of what the difference is.
Right. Fundamentally, the training is the same. It entails 4 years of medical school after a 4-year undergraduate degree, which is usually heavy in the sciences. Following the medical education comes some sort of postgraduate education as far as residency training, which could be upwards of 3 to 6 years depending on the specialty that you choose. Really what the main difference is kind of the approach to medicine in general. Osteopaths have a more of a holistic approach to the patient. The patient is not necessarily seen as just a symptom, but as a person, as a whole body system. We spend lots of training in school focusing more on the musculoskeletal system, the nervous system, and their interactions together and how that affects how the body basically has a good level kind of homeostasis, kind of the way that the function of the body is, so that you focus your care on the whole patient and the whole well-being of the patient. Traditionally, you'll hear patients say that the osteopathic physician may spend more time with them, but although we don't spend any more time, you know, a 5-minute appointment's a 5-minute appointment. There's more listening that goes into play with your appointment. There's more more hands-on experience. Some of us call us touchy-feely doctors, you know, because our physical exam skills are usually a little different. Again, since it is focused mostly on the musculoskeletal system from that standpoint. And one of the big differences in training is we learn a technique called osteopathic manipulative therapy, or manipulative techniques. And what that is basically manipulation of different parts of the body, whether it be the spine or the shoulder or the knee, or even the abdominal viscera, in order to promote a more, again, use the word homeostasis, a more balanced interaction between all of these different organ systems to just promote health in general. The osteopathic profession has been around for over 100 years. It was really a concept that developed back in the late 1800s by a physician named A.T. Still, who was actually a Civil War surgeon, an MD, who just was kind of fed up with the way that we were treating patients. You know, a lot of the medications we were using were in some cases harmful and not effective. So he looked for another approach to the patient to see if there was some better way that we could be, you know, caring for people. And then over the years, it has gone from an alternative type of treatment to a more complementary, and now we, you know, stand side by side with our MD brethren in providing, you know, quality health care to the community.
Well, I think something that's so important that I want to bring out too is this seems to really fit well in your specialty, because you know what, your specialty is so much involving the whole idea of rehabilitation and of musculoskeletal stuff. It really lends itself to your specialty even more than even other specialties. Now, one of the other things I want to bring out, because I think you brought up a lot, is this whole idea of rehabilitation. I think a lot of people wonder, what does he mean by rehabilitation? What kind of things are we talking about? Are we talking about the patient that loses their leg? I know that can be part of it, but what kind of things are involved in what we call rehabilitation?
Rehabilitation is it's a multimodal approach to the patient. Traditionally, we think of physical therapy as being rehabilitation. That's one kind of therapy. Physical therapists primarily focus on the axial part of the body, meaning the trunk, the spine, the neck, the lower back, the lower extremities. Then you also have occupational therapists who deal with more of the upper extremity and the hand. And then you throw in recreational therapists and speech therapists. So there's all different types of rehabilitation that falls under really the guidance of a rehabilitation physician or a physiatrist. When we work in an inpatient setting doing trauma rehab or stroke rehab or brain injury or spinal cord injury rehab, we work as that team leader to make sure that the patient is getting the maximized care of all of these different therapeutic subspecialties. So we essentially have to be a specialist in all of those different domains, physical therapy, occupational therapy, and so on, to make sure that the patients are getting the best service that's needed. One of the things that I promote is when you come to see a physician like me, we actually write a prescription for therapy. It's not necessarily just checking a box, or I'm going to send you to physical therapy, and they do whatever they want. The purpose is for the therapist to do a directed prescription and to do what's actually prescribed in order for the patient to get the most benefit from that. And I think that's the benefit to going to a physiatrist really for any musculoskeletal condition, is that I think the overall comprehensive care and evaluation of the patient, it's much better, because we're all focused on patient care and having those outcomes that are much better.
That's excellent, because that's one of the things that we've done so much on this show to try to promote, is that patient care is the most important thing. When we come back, we're going to take another look at one of the things that Dr. Newton does in his specialty, and that's the whole idea of chronic pain management. We'll see you after these messages.